tell us about, from a Democratic point of view, is this almost a Christmas gift to you? Because as you know well, we'll put up a chart here that illustrates what you know. Healthcare comes out consistently in polling as the most important issue. When they polled Americans, fully a third, 30% of all Americans said it was the most important issue. And that was followed by economy and jobs, way down at 21%. So is this someplace that you want to fight that next election?
No question about it. We would love to have that debate. I would just hope that the president will do as Democrats did, especially President Obama, lay out his plan. Let the American people vote on his plan, not whether or not there is a plan that he's got secretly stored away somewhere, as Nixon had when he promised to get us out of the Vietnam War with a secret plan that nobody ever saw. He doesn't have a plan. He has no intentions whatsoever of allowing people to have their government reflect their dreams and aspirations, and that is to live a productive, healthy life, and to have their children who come into this world have a good opportunity to succeed in life. And having good health care lays the foundation for all of that. Children are not going to do well in school if they don't have the ability to see doctors and to get health care. Employees are not going to be good, productive workers if they don't have good health care. It is at the foundation of everything. And economically, all of us are aware that it is the personal health costs that bankrupts families more than anything else. And so I would hope that the president will stop playing games with the American people and just come clean and says, let's work together to improve the Affordable Care Act and stop all of this hide and seek business.
And Representative Clyburn, I'm sure that the American people share that view with you. That's why they rate it as so high. But I really want to ask you, on the Democrat side, as far as the plan goes for the Democrats, what is the danger of overplaying the Democrats' hand? In this sense, you have people both running for president and not, who are strongly backing now single payer. They're saying Medicare for all. Isn't there a risk that that will actually scare off the American people, in part because of the cost?
Well, I have no idea which one of their plans they are really talking about until they lay them out. Let me tell you what I view. I think that whatever it is, if it's education, it should be accessible and affordable. Healthcare, accessible and affordable. Housing, accessible and affordable. So if you make healthcare accessible and affordable, you can put whatever tag you want to put on it. So all we're trying to do, we think, we've laid a foundation with the Affordable Care Act to build upon. We treat this as we treat any other piece of legislation, to get us started and have some experiences, look at what the experiences have been, and see what needs to be fine-tuned, what needs to be corrected, whatever it is. But you can't do that by starting all over every time. Take a look at the experiences, and let's work together to improve the legislation that's already before us.
Mr. Congressman, as you know so well, healthcare is not the only issue pending right now up at Capitol Hill. There's a lot of initiatives from the House Democrats now to have various investigations, including demanding the Mueller report, things like that. Let me ask you, in terms of investigations, how far should it go? And specifically on this subject, without regard to the so-called collusion issue, it's clear that the Russians did their best, dead-level best, to interfere with our last election. We have another election coming up. Are the Democrats willing to have a thoroughgoing investigation of what happened, both with respect to the Trump campaign, but also with the Obama administration, under which a lot of this interference actually happened?
Well, absolutely. That's why we have, 6 committee chairs who are moving on this question. They are doing their work. We've got 15 other committees that are working on stuff. The Energy Commerce Committee is working on health care. We're not, of course, I'm not on the committee, but they are worried about the investigations. Let those investigators, government oversight, judiciary, whatever, Ways and Means, let them do their work. But we have got committees the Appropriations Committee is putting together its budget. We are going to move forward on health care. We're going to move forward tomorrow. We'll be voting on Violence Against Women Act, and we're going to pass these pieces of legislation and let those investigators do what they know how to do. We on the other committees are going to be working on doing what we know what to do. I'm particularly working on rural deployment of broadband. I think we have got to focus on that kind of infrastructure rather than just roads and bridges.
Well, and that takes me exactly where I wanted to go. You are the majority whip. Your job is to make sure you can get your caucus behind you and get legislation passed. You got a new crop of congressmen coming in with this last election who wanted to get some stuff done. With all these investigations, all the other stuff going on, what do you think you can actually get done between now and the 2020 election?
Just looked at what we've already done. And we've done great work. We have reopened the government. We have passed legislation to protect people with pre-existing conditions. We are getting ready to pass legislation on violence against women. We are doing the American people's work. We are paying close attention to these kitchen table issues that we think we need to do to make the quality of life for all of the American citizens better for them, their children, and their grandchildren. So we are working on these things. We aren't going to be disrupted at all. We're going to let those other committees do what they know how to do, and we're going to do what we know is before